to begin and then I'm going to start letting people in. Both you and Nate are co-hosts, and then I will make Charles Goodmacher a co. Does he need to be a co-host when he joins?
I don't think it's necessary just because he's not sharing slides.
Okay. Alrighty, let me start letting people in.
Great, so glad a number of people are already here. Oops, there's an M in my name at the end. Welcome, welcome.
So good morning, everyone. It's so great to see you guys here on a Friday. My name is Carrie Vile, and I am the health communications lead, and I will be co-hosting the Health Council Talks today. So a reminder, as always, to introduce yourselves in the chat. And today's Health Council Talks is going to be on climate change and health, building resiliency and equity. And we're going to start the meeting off with a land acknowledgement. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and the ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And here is a quick overview and save the date of our next Health Council Talks. Shelley, I'm going to stop screen share and you can take the floor.
Oh, thank you so much. And it's actually not even noon yet, so maybe we'll give people another minute to be joining us. It's great. Really, really happy that you are all here with us. And as Carrie, thank you so much for organizing it. I was so excited to see that Carrie was the new communications director for the New Mexico Alliance for Health Councils. It's really great to have you in that role. So I'd like to welcome, I know so many of you. Shall we go ahead? I'll start by introducing myself. And my name is Shelley Manlev. My pronouns are she, her, and I am the former president of the New Mexico Public Health Association and on the advisory council for the New Mexico Alliance for Health Councils. And I'm just, as a public health advocate and leader, really thrilled to support health councils in all your work and see you as a critical part of addressing all of our public health needs, of course, social determinants of health, and also environmental determinants of health, which is what we're going to be talking about today. So I'm here with my colleague, Nate Matthews-Trigg, and I'm so fortunate. Nate is really at the heart of this work in terms of his expertise and his public health passion. I'll let him share a little bit more about himself. But what we're going to be doing today is starting with a question in the chat, and I will go ahead and put it in as you come on. please do introduce yourself. And I'd like you just to think for a moment before Nate steps in. And what changes have you seen in your community related to climate change? Please just take a moment in the chat. What changes have you seen in your community related to climate change? I'm going to type one in, which is lots more smoke days. I live here in Santa Fe. But please introduce yourself and answer that question.
All right. Good afternoon, everyone. I can officially say it's the afternoon. As Shelley mentioned, my name is Nate Matthews Trigg. I'm an affiliate instructor with the University of Washington, but I'm based in Albuquerque, New Mexico, and I do disaster preparedness work. And also, climate change is really what drove me to be interested in disaster preparedness. And as you'll see, climate change is going to be increasing the frequency of extreme weather. So Shelley, do you want me to show my presentation right now?
Well, why don't we just lift up,
or do you think we should wait a few minutes?
No, I think let's lift up a few of the comments that people have made in the chat.
Perfect.
You know,
Sounds great.
Haja, you talked about poor air quality. Shay, less snow than in the past. Oh my gosh, right? Even though occasionally we have like extreme snow, right? Holly from Otero County, more, again, poor air quality, and then flooding. We're seeing flooding. Severe dryness. Mary Lombach from Hardin County, you know, limited moisture, less rain. Valencia County water table is dropping. Diana, good, thank you so much, right? Really huge impacts on water quality. Lots of folks needing to drill deeper for wells, or when they drill, right, not finding water. Joyce, what county are you in? You wrote no water for irrigation needs being released for our farmers, ranchers. Are you able to share? Thought we'd ask just a couple.
Yeah, you might be on mute.
Joyce is from Clay County.
Oh, great.
And I basically had the same thing as I'm Brenda from Clay County.
Right, Brenda, are you able to share just what you're saying in terms of drought?
I guess what I wrote that because of the low water levels at Conchas Lake, we don't have irrigation water. And that limits what our farmers can grow. So we are losing a lot of our agricultural community.
Yeah, thank you. Nate even added in one. I can't pronounce this, Nate. Can you help me pronounce it?
Yeah, the Aedes aegypti mosquitoes have just within the last 2 years become endemic to Albuquerque. For people's awareness, these are the mosquitoes that potentially could carry yellow fever, dengue. It's right now it's more of an annoyance, but you know, it could become a lot more serious in the years to come.
Great. So thank you so much for being here, Charles Goodmacher, lobbyist, and with Do Good LLC, who's working on the legislation we're going to be talking about today, has also joined us. Charles, you just want to say hi?
Sure, thank you. It's an honor to be here and honor to work with Shelley and Nate and the rest of you on this important legislation. Thank you.
Great, thank you so much. And again, thrilled that all of you are here. What we're going to be doing today, perking ourselves to learn more about climate and its impact on health, talking about the legislation, the Public Health and Climate Resiliency Act, health bill, and what you can do in terms of getting involved. And so again, learning first. Nate, you want to start?
Yeah, and I'll just turn off my camera to hopefully maintain my bandwidth on this. Second. All right, are people able to see that?
Yes.
Good.
Yes.
Okay, and you're able to hear me.
If people have questions, So Nate's going to talk for 10, 15 minutes. Please put questions in the chat. We'll definitely have time for question and answer. We're going to do breakouts as well. So, there'll really be an opportunity to do that.
Perfect. All right. So I'll be speaking about kind of climate change impacts in New Mexico, and then also the climate science on what we can expect in the future. And then we'll talk a little bit about adaptation. And then, later we'll talk about the legislation that we are working on to try to address some of these challenges. So I want to start with this quote from the late Dr. Carl Sagan. Anything else you're interested in is not going to happen if you can't breathe the air and drink the water. Do not sit this one out. Do something. You are by accident of fate alive at an absolute critical moment in the history of our planet. So what has happened? We know that emissions have raised global temperatures 1.2 degrees Celsius above the pre-industrial baseline. And we are on course to reach 1.5 degrees, which is seen as a critical threshold within a decade. I was actually just reading the other day, as we're going into an El Nino cycle, some researchers believe we might reach the 1.5 degrees this year, actually. So the rapid rate of change is stressing and collapsing many of the vital natural systems that we rely on for our health and for our well-being. And like COVID, we know that the risks from climate change are not shared equally. Already in New Mexico, we've seen historic drought, historic wildfires, temperature extremes, storms, and vegetation loss. And we know that New Mexico is particularly vulnerable. We have a large percentage of our population who are elderly, large percentage that are children, people living in poverty, people with disabilities, migrants, people that work outdoors, and so on. And this here shows how New Mexico compares when it comes to vulnerability to other states in the US. And we can see that New Mexico is by far more vulnerable than the other states in the Southwest, but also all states pretty much west of Arkansas. And this is of course related a lot to our demographics. And what does this mean? So we could see ourselves getting into a vulnerability feedback loop where a wildfire can create physical and psychological trauma, can lead people to lose their livelihoods, their loved ones, and their communities from displacement. And that can lead to a loss of stability and support in people's lives, making it more difficult to access services, which can exacerbate chronic diseases and lead people to develop diseases of despair, such as substance use, suicidality, other mental health issues. And then this makes people even more vulnerable to physical and psychological trauma in the future.
Listening to
and if someone
meeting.
could please mute. All right, thank you. So this is also what really keeps me up at night. This here shows that kind of regardless of our emissions, we will continue to see warming in New Mexico, doubling the warming we've already seen, potentially by the end of the century. If we continue to emit greenhouse gas emissions, the temperature will just keep rising, and we will just continue to see things get worse and worse, potentially, going beyond our ability to adapt in many cases. But even if we stop all greenhouse gas emissions today, we will continue to see warming, doubling what we've already seen. So because of this, we are going to see the changes we've already seen continue to get worse. This means climate-related hazards will grow in frequency, intensity, and duration. The likelihoods of disasters on an unprecedented scale will become more common, and we're likely to see direct and indirect impacts with significant social and economic implications. I know already we heard people talk about drought and how it's impacting agriculture. We believe that we'll continue to see worse drought in the future. So days and nights are getting warmer in New Mexico. On the left, we see the maximum temperature of 100 degrees Fahrenheit or higher in New Mexico, with a sharp increase from about 1980. And then warm nights are getting hotter. And this is particularly bad for human health because, we really depend on cool nights to help us, our bodies kind of recuperate from the heat during the day. So as the nights get hotter, we have less ability to kind of cool down. And we see that there's a significant trend across the United States when it comes to extreme heat events. So heat wave frequency, the duration of heat waves, the intensity are all going up, as is the season in which we experience extreme heat. We're also seeing a dramatic increase in what we call wildfire weather days. These are days that have particularly windy, hot, and dry conditions. Between 1973 and 2020, all regions in New Mexico have seen a dramatic increase, with the Northern Mountains region seeing 60 additional days. That's the highest increase across the whole United States. And we really saw how this played out just this last summer, with more than 1% of the entire area of the state burning from the wildfires. We saw, close to 70,000 people being evacuated in a single day, and many, many people being displaced, homes burning. And what we know is that there's a likelihood of what we call the hot-dry feedback loop. So as temperatures increase in New Mexico, things will get drier. We'll see more vegetation loss as a result of this drying out. And then that means that there's less moisture in the soil. Temperatures become hotter as there's less shade and less vegetation. So if we look at the kind of climate change impacts on human health, we see that, shifting rainfall, warming temperatures, and wildfires can lead to, droughts, flooding, violent storms, extreme heat events, more fire, more smoke. And this can mean direct impacts to people's health, such as injury and trauma, mental illness, heat stress. And as I mentioned with the Aedes aegypti mosquito in Albuquerque, it could lead to an increase in insect-borne diseases, lung diseases, and increasing allergy. And then this has many downstream impacts. So, an increase in poverty and food insecurity as supply chains are disrupted, diseases of despair as people's livelihoods, are become in jeopardy, and people turn to substances and have severe mental illness, and then just deteriorating health and well-being as people are less able to access healthcare, and then a loss of support too as people's communities are displaced. So in New Mexico, when it comes to heat impacts, we've already seen some pretty significant changes. Heat emergency department visits in New Mexico have doubled since 2009. And we actually think that this is largely an undercounting. These are simply emergency department visits that are recorded as being directly related to heat stress. However, we know that heat can impact people in other ways, such as creating cardiovascular or respiratory emergencies, as people's bodies are really struggling to keep themselves cool, and it puts extra stress on their hearts. Heat waves already kill more people in the United States each year on average than any other weather-related disaster. And we only expect this number of morbidity and mortality associated with extreme heat to increase. We also expect an increase in wildfires, and we've already seen this last summer a pretty dramatic increase in emergency department visits related to smoke, which I'll talk about in a second. But on the right, we see how New Mexico compares to other states when it comes to wildfire risk, high potential consequences, as we have many people living in areas that are forested, but also an increase in the likelihood. as we see, especially the mountain regions drying out. And then, as I mentioned, with fire comes smoke. Just this last summer alone, we saw 2,555 respiratory emergency department visits in New Mexico, which was up 18% from previous summers. And 80% of those people were from the most vulnerable communities. And we know that long-term exposure to wildfire smoke has been linked to the development of childhood asthma, increase in risk of heart palpitations and heart attacks, decreasing lung function. And there's a growing body of research looking at the connections between wildfire smoke and certain cancers. So as climate change is going to be impacting our health, so too does it impact the systems which we rely on for health care. So climate change is impacting our access, whether it's, extreme weather events, impacting transportation infrastructure, making it harder for people to get to clinics, or displacing people, making it difficult for them to, see their providers. We also know that it'll create an increase in need for healthcare services. And then also, as our healthcare services become overwhelmed with this increasing need, we know that the quality decreases. And we saw this largely during COVID with large patient surges, overwhelming emergency departments, kind of decreasing the quality of care. So there are many other ways that climate change can impact our health. Here are some New Mexico specific headlines kind of highlighting it. So impacts to critical infrastructure, large scale displacement, supply chain disruptions, infectious disease risks, and injury and suffering. And as I had mentioned, many downstream impacts. Potential for increase in mental health stressors, psychological trauma, adverse childhood events as children are exposed to extreme weather events, increase in poverty and food insecurity as people's livelihoods are impacted, diseases of despair, chronic diseases. We do see a spike in people developing diabetes after hurricanes, and we expect this to be similar, where people are, less able to access, the food and, the care that they need. And then also political tensions over scarce resources, such as water scarcity. The costs from climate change are increasing. The United Nations described it as a spiral of self-destruction. We see the number of billion-dollar disasters increasing significantly. This graph here shows kind of the time between billion-dollar disasters decreasing. And the projections show that by the middle of the century, we could see a billion-dollar disaster every single day. So before I moved back to Albuquerque, I was living in the Pacific Northwest in Seattle, and I was doing disaster response work. I was actually in Seattle responding during the 2021 June Pacific Northwest heat wave, which was what they called a once in 1,000-year heat dome event. And there was a lot of really interesting research done to see, how common is this sort of event? And then looking in the future, what can we expect? And it's really quite sobering. So what would be considered a once in 1,000-year heat wave by as early as 2040 might be something we experience every 5 to 10 years in the United States. If we look at the impacts of the heat wave, it was absolutely shocking. We saw an incredible spike in emergency department visits, as you see on the screen on the top left. And then as a result, a lot of people tragically lost their lives. Close to 500 people, making it by far the most deadly extreme weather event in Pacific Northwest history. So pretty much all leading public health and healthcare associations have declared climate change an incredible emergency that needs to be addressed. here are some of the kind of headlines. So what can we do about it? So I want to talk a little bit about climate adaptation. And then later we'll get into kind of the legislative bill that we're working on to kind of kickstart this sort of action here in New Mexico. So climate adaptation is really what can we do to prevent or reduce the impacts of climate change? That's climate change today, but also in the future, knowing that it will get worse. And this can look like a lot of different things. This can be addressing the underlying inequities and vulnerabilities that we talked about. It can be fostering connections and empowering communities, to address climate change impacts. It can be reducing outdoor and indoor air pollution, preparing communities for extreme weather, developing more resilient infrastructure, promoting the co-benefits of mitigation, so reducing our emissions, and adaptation, such as helping people have better insulated homes or creating solar panel microgrids. So if the power goes out, they've got backup power that can run their CPAP machines, for example. And then also there's an incredible need for education and outreach around the health impacts of climate change and what we can do collectively working together to address it. And then I want to end on this slide. So this slide here shows kind of what states in the United States have climate and health programs. As we can see, there's a growing number of states, with New Mexico not currently having one. And then on the right, we see kind of the federal government funding to address kind of climate change called the BRIC program, Building Resilient Infrastructure and Communities program. And we can see what communities have in 2020 got a lot of funding to kind of kickstart their climate adaptation work. And as we see New Mexico in 2020, local communities did not get that money. And we have seen a small increase in the funding, but there's a lot of room for improvement. So I will end there, and I'm happy to answer any questions that people might have.
Yes.
All right. Any questions?
Nate, Nate, yes.
Yes.
This is
Uh-huh.
Evangeline
Yep.
Zamora. I have my camera off, but in that slide that you show where there's a spike in the emergency room visits,
Mhm.
is that do you remember that? So it was higher than COVID. Were they for respiratory issues, or what kinds of things were they going in for?
Yeah, so people are going in for all kinds of things. Apparently there were people with 3rd-degree burns, people going barefoot outdoors, a lot of people coming in with heat stroke and heat stress. And then we saw a lot of people coming in with, strokes and heart attacks, people having difficulty breathing. So what we see is when people experience, really high temperatures and don't have adequate access to cooling, right, their skin gets really flushed, and that's their body's trying to cool itself down. But that really requires extra, heart rate in order to increase the amount of cooling, and that can really stress people that have, cardiovascular issues. So people are coming in for all sorts of things. And we heard some incredible kind of stories from a lot of the, ED physicians. One talked about how they had to lay out body bags, and they packed the body bags with ice. And as people came in, they just had to put them in these body bags in order to cool them down rapidly, as they were so overwhelmed, they couldn't kind of do it in the traditional way they would. And just the thought of coming in with heat stroke and being put into a body bag is a very scary idea. But these were the sorts of measures that people had to take because the spike of visits was just so dramatic over just a couple of days.
Well, those are very devastating facts. That one leads to another, the mental health piece, and not only the physical, but the mental health. So thank you for
Definitely.
Thank you.
Definitely. Yeah.
Another question or comment?
This is Diana Good. Do I understand correctly that if our state doesn't have a a law that says we're going to do this, that we can't apply for the federal funding as a state?
No, so it's a complicated thing. So there's a growing amount of money available from the federal government to try to kind of address climate change impacts. Traditionally, this funding comes through the state and then through the state to local government. What we have heard from talking with a lot of county emergency managers is they just don't have the capacity to apply for these grants. These grants require them to have a lot of expertise on what the future burden of climate change is going to be. It requires, so much, and they just don't have the capacity to do it. So we recognize this as being a major gap that we're going to try to address in this legislation. I'll kind of save the details for later. But the contradiction is that the federal government wants this money to go to the communities that are most vulnerable, but the communities that are most vulnerable don't have the capacity to apply for the grants. So that's what we've seen. New Mexico State got significant funding to do a lot of climate planning, but the local communities just were not able to apply.
Great. So,
Yeah.
I mean, there is so much to learn about this and so much opportunity. We're really at a moment, I know, just, from my perspective, this summer, any of you who are in northern New Mexico, or, we know in southern New Mexico near Rio Doso, wildfires burned a lot of New Mexico this summer, the largest wildfire ever in the history. And that's climate change. And as Nate said, there's so many different dimensions. I have to say the smoke is, for all of us, but especially for people who are most vulnerable, for elders, for children, for people with asthma. That alone means that we have to be doing adaptation and resilience. I'm going to shift and talk about an incredible opportunity that we all have to engage in action. And excuse me, it's not the right share. I'm not quite sure why. And you will we'll put in the link to a copy of the PowerPoints, as well as it's not doing it. Anyway, let's go to the right. I'll do it a different way. So we are launching. I'm going to take a moment to get my screen up. And, maybe as I do that, for the last 6 months, following a effort with the Public Health Infrastructure Task Force, HM2, which had 4 priority recommendations, one of which was for funding health councils, incredibly important, right? And the second of which, or they weren't in order, but a second one, which is to support the development of a climate and health program for the Department of Health. Currently, the Department of Health has a 0.2, that means 8 hours a week FTE, to specifically address climate change. And a 0.2 FTE is not enough to do climate change adaptation and resiliency building work. So what can be done for this legislation? We have worked with legislators, public health community, New Mexico Voices for Children, and the New Mexico Environmental Public Health Network have been working on developing the Public Health and Climate Resiliency Act. We're very excited to say that SB 5 and HB 42, with a powerful team of sponsors, which I'll share in a minute, but I want to make sure you know what this act is. The act will create a climate and public health program, exactly what was recommended by HM2 Task Force and what might have been funded by the Centers for Disease Control, but when New Mexico submitted its grant, they said we lack capacity. I think you all know this, right? Those of you who've sought grants, it can be a catch-22. So our state really needs to take responsibility for our needs as, the state west of Arkansas. I actually hadn't heard that before, and, experiencing the effects we know, to build some solid expertise in the New Mexico Department of Health. I see Maureen and Diana Good here from NMDOH. Our health promotion specialists need their capacity built, right? So that they can engage with these issues. Our health councils, our communities. So it would provide the capacity to support training and technical assistance. It would have a health equity specialist, a tribal liaison, right? Coordinator to work with our tribal nations, pueblos, and tribes. So it would focus on interagency collaboration. Right now, we do have the Environment Department and the Energy, Minerals, and Natural Resources, but our Department of Health needs this expertise to bring in health equity, health communications, preparedness, and response. And that allocation would be a $1.1 million allocation to fund 6 positions. Secondly, and I think something that health councils, you're hot off the press in the sense that we're talking about actually establishing a public health and climate resilience fund. $5 million, good start, right? We could be using a lot more money than that, but it would assist local communities in preparing for and responding to public health emergencies. And if you look at that third bullet, it would involve, it specifically states in the legislation, it would involve local health councils as direct participants in the planning process. So preferences are given to low income and rural communities and disadvantaged communities. And again, the intent really is, these are not huge grants, up to $250,000, but in Quay County, that can make a difference, right? It is to local jurisdictions, including tribal jurisdictions. So it could be for a school district or an acequia, but could be for a city or a county. And it also, and I think it's really important to say, could be used as matching funds. That in the case, one of the things that's made it difficult, especially for smaller jurisdictions, to access some of the federal funds that are available, is they require a match. And, for many of your counties, those matches are difficult to find. And so this money could be used to match for a federal grant application. So this act, we're very excited about it. And as you can see, we have, I'm going to say thanks to the tireless work of New Mexico Voices for Children and Charles Goodmacher as the lobbyists that they have been helping to support, have an incredible team of sponsors, Senator Liz Stefanik's, Representative Liz Thompson, we call them the Liz Power Team, are the primary sponsors, but they have many co-signers, and the folks you see, both Senator Michael Padilla is the majority whip in the Senate, Representative Rena Sapansky. If you are a constituent of one of these representatives and senators, please thank them. If you don't know who your representative or senator is, let's put in the link how you go find your legislator. But it is a powerful team. And when you ask for money, I'm going to say especially recurring funds, there's a powerful lot of work to be done by all of us who care. We have a long list of organizational endorsements. I'm thrilled, I have to say with the range, particularly excited to see, and I think you may notice that I should have highlighted it for this, the New Mexico Alliance of Health Councils, the group, the umbrella group for all of you who are involved in health counselors, has endorsed this bill, and hopefully the folks who are lobbying with you will be working on it. Everything from Health Action New Mexico, the Pediatric Association, lots, Center for Health Innovation, our Public Health Institute, recognize these are health organizations, Blue Cross Blue Shield of New Mexico, Presbyterian Healthcare Services. These are health groups, of course, our environmental partners, and are in support of this. They've got tremendous work to do on reducing emissions and the mitigation, methane, et cetera. And we as a public health community really need to make sure our communities are better prepared. So, call to action. I think many of you who know the way in which, that as people who are so intimately connected to the health of our communities, some of us can educate, some of us can advocate or lobby. I understand that for those of you who are hired by government contracts or work under that, your role is education, and you can do that, not naming SB 5, not naming HB 42, but just looking at the fact sheet and talking about climate change with your community and the health impacts with your legislators. That's education. Those of you who either as private citizens or in your role with a nonprofit are able to lift your voice as advocates. As an individual or an organization, you can fill out a form at New Mexico Environmental Public Health Network.org, ephn.org, nmephn.org. We have a great fact sheet to share. It's really well done by New Mexico Voices. We would appreciate if you would contact your legislature. I'm not going to make you raise your hand if you know who your legislator is, but I really, as a public health, someone who cares about public health and the health of your community, I hope that you have an informal relationship with your state representative and senator. And if you're able to advocate or lobby, that you specifically support and ask them to support SB 5, HB 42. If your organization is willing, your health council gets engaged in issues, we'd love a support letter, and Amy Miller from the New Mexico Environmental Public Health Network is going to be coordinating those. We have support letters from many organizations. And then we are fortunate that our bill, SB 5, is going to be one of the, I think it's scheduled to be the first bill heard in SPAC. And who wants to tell us what SPAC is? Senate Health and Public Affairs Committee, cracks me up. This Monday, January 23rd at 1:30. And we would love to know, if there's anyone here who is able or willing to either attend this committee hearing, or there will be more, right? It runs to the Senate, it runs to the House, it's will be assigned to multiple committees, and including the most challenging of those committees, which will be Finance and House Appropriations. But it's great to know if you're able to tell us you're able to attend. I already have 5 people committed, and this afternoon at 3 p.m. we'll be doing a different kind of information session talking about how to do, and I know many of you have trained to do 1 to 3 minutes of public testimony, right? When you just make a comment briefly saying who you are, why you care about this issue, right? How it impacts your family, your community. So there will be more opportunities, and I'm just going to look in the chat because I know that Charles has been helping to write a letter to your legislature. You can see, I'll stop the share for a minute. He set up an action network, makes it very easy to contact your legislator. And the House bill is identical to the SB 5 and HB 42 are exactly the same bill. So I'd love first just to hear if there's questions, and then we're gonna, let's questions about the bill, questions about actions to take.
Am I the only one that's really concerned about that? If we completely stopped fossil fuels like right now, nothing would get super better. Like that's.
It will continue to get worse. I mean, maybe Nate wants
Yeah.
to speak more to that, but it's really important to know that, we need to reduce our emissions, right? A lot of folks are involved in that, but the changes are already in place. Please, Nate.
Yeah, so we've got a window pretty much. This window is kind of the range of temperature in which we are able to adapt. So if we continue to emit greenhouse gases into the future, we could surpass our ability to adapt. But right now, like with the impacts we're seeing from wildfires and what we will see, even if we stop today, our greenhouse gas emissions, we'll continue to see warming for the next 50 years. We have to address those health impacts. And when we do stop our greenhouse gas emissions, likely that temperature will not go down dramatically. It will plateau for quite a while. So wherever we stop is where those climate impacts, that extreme weather will kind of plateau at. So it's not either or, it's both, but this is trying to address the adaptation side of things.
Yeah, and if I could add too, this bill is not meant to be or envisioned as a complete answer to protecting everybody's health. We know that as the point was made, we have to mitigate, we have to reverse climate changes in order to truly protect people's health. That being said, there are many other bills that are directed at mitigation. This bill is all it does. It's not like it's an all. Like it's something small. It's critically important. It's basically, you're all public health people. to my mind, this is similar to, knowing that there's an increase in obesity and doing nothing about it. It's similar to an increase, a pandemic about to happen, and the public entities not responding to protect the public health. It's a public health issue. The damage that's being done to our health now and will be continued to be done, and as Nate made the case so well, it's going to be even worse soon. So this is really about starting the effort to get our health protected as climate change is happening to us, period. Hopefully then, and some people have criticized, oh, it's not enough in the fund. It's not enough. I would agree. This is a great first step that we think we can get through the legislature this year to get the program funded. I fully expect in the coming years, we are going to suffer more from climate changes that will happen. Some entities, some counties or whatever will use this program, and they'll start creating programs, and their people will be better protected as those events unfold than the areas that didn't use the program. And there's going to be more demand in the future to grow this program, I believe. Thank you.
What I'd like to do at this point is give you a chance in some small groups to talk for about 4 minutes or so, just to, are you hearing in your communities? What are you seeing? How you might engage in this? And then we will come back together at, for the last 10 minutes. And
Shelley,
yeah.
We have our program coordinator, Kiana, wanting to share a quick information really quick, if that's okay.
To do that now? Sure.
Yes. She has to log off in like 2 minutes, so
Yeah.
Go ahead, Kiana.
Hi, everyone. I'm so sorry to interrupt right in the middle of this, but I have to log off. First of all, to everyone I haven't met, my name is Kiana Clay-Keeney, and I am the new public health program coordinator here with Alliance. Super excited to be here. Val was initially going to give this update, but actually had to run off. So I just wanted to give a very quick update regarding the HB 49 bill that was submitted earlier this month, as some of you may know, for county and tribal health councils. And so it's actually officially assigned to Health and Human Services Commission and is scheduled for this upcoming Monday at 8 a.m. So I just wanted to quickly invite you to please join us with public comment efforts. And I am going to provide the meeting information and link to the bill itself in the chat. As some of you know, this bill is proposing an appropriation to the Department of Health for county and tribal health councils statewide. And so we feel that your input is just going to be so pertinent. And, I wish I could stay on longer, but if you have any questions, feel free to reach out to any of us. And then I think that Carrie is also planning to send out a call to action. So you should be receiving that in your emails as well. Thank you so much, everyone.
Thank you, Kiana. And I think it really speaks to, HB 49 is incredibly important. That's something I'm strongly supporting. And again, as educators and as advocates, those of you who can advocate, if you can come to the Roundhouse, I'm sure it'd be great to be there all day, right? Start at 8 o'clock and stay through. For the Senate, it's a chance to learn about the process and to have your voice be heard. So I always find it most useful in these to have a little time to digest in a small group. So I'm going to go ahead. We will come back together for the last 10 minutes and share some of what we've thought about and shared with each other. But the question is, how might you engage around climate change, resilience, adaptation as part of your health council work, as part of your own work? And everybody clear about the question? I'm going to go ahead and create rooms there. You know, there are rooms with 3 or 4 people in them. And we'll come back at, like I said, at the last 10 minutes. Right. Okay. So I'm curious, Carrie, I don't know if Mary Ann's with us or who's here from, 2 people are here from NMPHA. Sometimes I like, yeah,
Hi, we're just in viewing capacity today, so thank you.
great. Hi, Tessa.
Hi, this is Mary Ann, Sandoval County. I'm also in viewing capacity. I've got 2 meetings going on at the same time. So sorry.
Great. Well, I'm glad you could participate in this, all of you. Maybe I'll go check out another breakout room. Great, welcome back. Thank you so much. So comments, anyone want to share something that emerged from their conversation? I'll just share that I joined a conversation with Vanessa and Ryan, and one of the things that emerged is opportunity to have presentations. Nate, myself, we have a team of people, including healthcare, clinicians and others. We are available to provide educational presentations for health councils. Please feel free to reach out to me, and we'll make that happen. What else emerged that people are interested in doing, learning more about, or opportunities for engaging more?
In my group, it was Elizabeth and Christopher. This is Nicole Romero, and we were just discussing that our health councils, they're focused more on like things like substance abuse and all that good stuff. But I did mention that Mary Lombuck and her group bought the firemen some equipment. So, but it's just like I said, it's hard to focus on climate when there's other issues, unfortunately.
Nicole, thank you so much for sharing that, because it is, we've moved our communities to address social determinants of health, and environmental determinants of health are really challenging, and especially things that seem far off. But of course, what we know is they're not far off. And when that disaster happens, when that wildfire smoke is there and that flood is there, drought, when people can't, I was just listening to farmers in Gallup and the impact on food quality. It's quite profound. So it is a deep challenge. There's so much, and it is, it's critical for our communities, and hoping that health councils, again, as you divide up into different groups, right, and bring more people in and develop your own capacity through HB 49, which is critical. But thank you.
And I can also speak a little bit to that. So what's really interesting is, when I was in the Pacific Northwest doing emergency response, when there was an extreme weather event, whether it was, a huge amount of snow that was impacting transportation, or flooding, especially like California is currently experiencing, the two most critical health pharmaceutical resources is dialysis for people that need it, but also methadone access. So people that have substance use disorder and have medication treatment, climate change and extreme weather can disrupt people's access to that. So it's this kind of compounding issue. And it's incredibly important to think of them as being interrelated as opposed to kind of different topics. Climate change is really a threat multiplier.
Yes. Another comment or two from groups that met, what you discussed? Yeah, Diana?
Well, I'm also struck by how integrated this is with even economic development. Like if there's no tax base in a county, hardly, then it's really hard to hire a grants manager who knows how to write these grants or administer them once they're received. So I don't know if this fund can be used to fund counties at the SVI indexes. Those counties get priority to hire other staff to maintain these monies, because it's hard. And the expertise to write those I don't have that expertise to write a climate resiliency grant, not really. If I was at a county, go ahead.
That's a great question, Diana. The bill, we thought about that in the bill and wrote in several provisions. It doesn't exactly that could be part of what your county applies for, or city, or whatever the jurisdiction is, could ask for money for a grant writer, because then you could also use that, to pursue the federal grant opportunities that are available for local communities, as well as for other state grants. There's a low-income weatherization grant program that was passed last year. It'll be coming on board very soon that local communities can apply for, as for instance. But also that written into the bill is also for the health department personnel. Part of their duties would be to help local communities access the data and and begin to look at what needs to go into a grant. Finally, also, there's no matching requirement for this grant. That's on purpose. Also, there is a provision that 50% of the funds would go to rural communities. So we're making sure that communities like your own that don't have the access at least have a better opportunity.
Great. Marilyn?
Were these, I might have missed this, this bill, is this reoccurring funding or is this a one-time shot? If it gets passed, will this continue on from year to year?
I'll also answer that then. Yes and no. The bill language is being amended to say that the funding for the health department personnel, the program would go through 2024 year through 2028. So that's 5 years. That said, sometimes, what that will do will be that it automatically puts it back into the budget process as an established line item. It doesn't guarantee next year that they will refund it again, just like any other thing, because they always have to appropriate every year, but it sets it up for that. Also, the fund is explicitly established as a 5-year fund. And again, I think there will be subsequent legislation to extend it later, but this is what we think is politically feasible to get us started.
I think the problem I see is that counties who don't have capacity are very reticent to take on even short-term grant monies requesting for personnel when they don't see that they can sustain that position into the future and that the monies available are a short-term shot. And things fall apart when you don't have reoccurring funding you can count on for these types of things.
And that's true at the state level too, Marilyn. It's really, that is an important challenge. And I think part of what some of these funds will be used for things, not necessarily for planning or personnel, but literally air purifiers, right? I mean, that costs money. And I have to say, again, for those of you who live with smoke, pretty critical. Water purifiers for those who are living in drought conditions, so people can have clean drinking water. There's a wide variety, but some of those things are pretty, making a functioning center, setting up a mini split system, right? So you actually have cooling and a backup generator. So there are concrete equipment that schools, libraries, community centers could use this fund. I think we're gonna, please reach out with questions. I do want to just share with you one more thing, which, this PowerPoint's available, sending out the link. You can, if you recognize your senator representative, you can reach out and contact committee members. That's at SHPAC. But also I wanted to tell you that for the future, there is a New Mexico Health Community for Climate Action group that's forming. A physician in Gallup, Paul Charlton, he's with the Gallup Indian Medical Center. Myself and a number of people want to really establish a statewide group that is focused on engaging the health community, and that includes professionals, students, social workers, health councils, et cetera. And we are looking for core group steering community members. Obviously, it's important that it represent our state. So Paul's out in Gallup, Dr. Charlton, myself here in Santa Fe. And core group's a big commitment, but we do need some folks who are willing to meet weekly, 5 or 6, and really sure. And then folks who are willing to come to a monthly steering committee, and really hoping that that will allow us to engage many states. There's 23 states, I believe, that have these groups to advocate, because without our voices, we're not going to be participants. And again, we've got to reduce emissions and do that advocacy, as well as make sure our communities get what they need to survive and thrive. So thank you really for your attention and learning. And please, if you would like education for your health council, feel free to reach out to me. And if you're lucky enough, as you know, Nate has deep expertise. So does Dr. Paul Charlton and many others that would welcome a chance to share with you. Yes, thank you so much. And thank you for inviting us. Carrie. That's
Yes,
really,
thank you.
we
Thanks,
really,
everyone.
Yes, thank you.
let's have great success in the session.
Thank you all.
Thank you.
Thank you.
Really appreciate you participating.
Thank you.
Charles, can you hang on just for a second? I'm sending you a contact in the chat.
Please.
Or did he already go? Okay. So I'll send it to Nate or Shelley. Who wants it?
Who,
Send it to Shelley.